Hello, Vandana. Is Anuj ji there?
यस मैम।
अनुज जी, मैं जानना चाह रही थी कि जब हम ये बैकड्रॉप लगाते हैं
हाँ
तो ये ऐसे कट कट के हिलता हिलता चेहरा क्यों आता है? आपको दिख रहा होगा इस वक्त ना, ऐसे आधा जैसे कटा हुआ, आई डोंट नो, जैसे रामायण के सीरियल में आता है, वो जब असुरों को काटते हैं तो ऐसे हिलता हुआ, कटता हुआ, हिलता हुआ चेहरा आ रहा है ना। आपको दिख रहा है मेरा वीडियो?
हमें सभी का ड्रॉबैक है, हमारे वेबएक्स का भी और माइक्रोसॉफ्ट टीम का भी। उसमें
अच्छा,
आता ही है ये।
अगर हम बैकड्रॉप लगाएं तो ऐसे ही हिलता हुआ आएगा, देखो
बिल्कुल
कैसा
मैम,
हिल
बिल्कुल
रहा है ये।
बिल्कुल। जी
हाँ,
जी जी।
तो इसका कुछ नहीं हो सकता बेसिकली ना।
नहीं मैम।
चलिए, कोई बात नहीं है, नॉट अ प्रॉब्लम। चलिए, ऑल द बेस्ट फॉर टुडे एंड आई होप आपको मेरा वो मिल गया होगा रात को, जो मैंने आपको करेक्शन करके भेजा था, है ना?
हाँ मैम, मिल गया है, वही अपडेट किया है मैंने।
डॉक्टर मूले का वो जीमेल वाला आ गया
हाँ
ना,
जी
वो लिख
मैम,
के
बिल्कुल
मुझे, है
बिल्कुल।
ना? अच्छा, चलिए, अगर कोई प्रॉब्लम होती है तो वंदना विल कोऑर्डिनेट देन।
ठीक है मैम,
थैंक यू,
ओके।
थैंक यू सर,
ओके।
ओके। Good morning, sir. Thank you for joining in early, sir. Thank you. Good morning. Vandana, are you able to hear me? Vandana?
Yes, ma'am. I can hear you.
Okay. And am I visible also?
Yes, ma'am. I can visible.
Okay. Thank you. You can call up your organizations to start joining and please call everybody.
Okay, ma'am.
Okay.
Good morning, Dr. Ava.
Good morning. I can't see.
I'm trying to open. There's
Okay.
an issue. I'm trying to open it.
Our chief guest is already here. He's very
Yeah.
punctual.
Yeah.
And even Dr. Das is here. Good morning,
Yes.
sir.
Yes.
Good morning.
Good morning, sir.
Just another
Am I
5
audible?
minutes. Yes, sir, you are audible.
Okay, wonderful. Thank you so much.
Thank you, sir.
Yeah.
Dr. Mule, sir, would you like to check your mic, sir? Can you unmute yourself, sir? Dr. Mule, sir, we'll just take another 5 minutes. People are just joining in, sir. Just 5 minutes more. Dr. Shalini, are you ready? Shall we start?
Yes, please.
Your video and all is sorted out, or you have some connection problems?
No, it's sorted out. I'm
Okay,
trying.
I was just trying to get through the IT team because one of the resource persons, Dr. Ravi Dikshit, is not able to log in. There is some problem, so
No, they are trying. They are trying.
they are trying. Okay,
Yeah.
fine. Then I think it's already
Ravi sir is
10:30.
facing some problem from his side. We are trying.
Okay, so fine. So we can start now, right? Okay.
Yes.
Dr. Mishra, are you there? Can you hear us?
जी बिल्कुल, नमस्कार।
नमस्कार। हम एक्चुअली कोई नजर नहीं आ रहे हैं ना, तो ऐसा लग रहा है कि कंप्यूटर स्क्रीन से बात कर रहे हैं एक्चुअली। सो okay. Great. So we can get started now. Good morning, everybody. Today is day 2 of our national webinar series on sustainable development goals and its linkages with social defense. And today's title is on senior citizens and inclusive societies, the issues, challenges, and way forward. So like yesterday, we have 4 panels today, very illustrious 4 panels, which will be covering different aspects that affect senior citizens. And as you all are aware that this webinar series is also going to cover the impact of COVID-19 pandemic on socio-psychological support systems, healthcare, income security, and overall well-being of senior citizens. So we have about close to 10 resource, more than 10 resource persons today, from academics, from industry, from civil society organizations, from government agencies and various bodies. And the first session we have will start from the introductory remarks from Dr. Virendra Mishra, who is Director, NISD, Ministry of Social Justice and Empowerment. And then there will be a special address from Dr. Jitendra Das, who is the Director for School of Management. Following which we'll have inaugural address from our Honorable Chief Guest, Dr. Ganeshwar Mule. He is the member, National Human Rights Commission in Delhi. And the session will be further taken forward by, with a vote of thanks by Professor Shalini Taneja. She is head of Center for Sustainable Development, Ford School of Management. And then in the panel 1, there is a very interesting lineup of 3 very different resource persons and different perspectives that we are going to get. Dr. Gauri Sen Gupta, who represents Ministry of Health and Family Welfare. We have Dr. Ravi Dikshit, who will represent the Indian Systems of Medicine from Kevaladham, Mumbai. And then we have Ms. Atrey Ganguly from WHO, who is going to talk on decade of healthy aging. So we start from introductory remarks from Dr. Virendra Mishra. He doesn't require much introduction, but for the people who don't know him and who have just joined for the today's session, he's an expert on anti-human trafficking. He frames social policy for development of youth. He has served in various ministries, though he's an IPS, National Service Scheme, Nehru Yuva Kendras, Kara, and he has been awarded the prestigious Herbert Humphrey Fellowship on the subject of human trafficking in USA, besides many awards and accolades. So he is right now heading very important division of social defense in the Ministry of Social Justice and Empowerment. And they are our main sponsors. Today's and this 3 days webinar series has been made possible due to their support. And I also wish to acknowledge and appreciate and thank Ford School of Management, especially Dr. Das. We have been their NGO partner for a few years, and they are always there to support us with not only knowledge sharing, but also their volunteers, their faculty, and Dr. Das himself is very committed in social issues. Before we introduce Dr. Das further, I would request Dr. Mishra to please start with his introductory remarks. Thank you.
Thank you, ma'am. And thank you, everyone. Good morning. So I know yesterday's webinar was very successful, and it attracted many participants and was also very engaging. So I congratulate Anugrah as well as the Ford Institute for doing so well. Today's discussion is again on a very important issue, as it was yesterday. That was on drugs. So today is on senior citizens. And I think to understand the issues of aging, it is very relevant first to highlight the demography, that is the statistics about the senior citizens. So yesterday in my introductory address, very vehemently, I was talking about the demographic dividend in India. I mean, the population, the high percentage of youth population in India. So as we say, like, more than 65% of the population is less than 35 years. And the average age of this country is going to be 29, or it is already 29 in 2021. For the youth definition, the age bracket is between 15 to 29. So we say that our country's age on an average is a young country. So this is what we were emphasizing on yesterday when we were talking about the drugs. So how to prevent the youngsters getting into the drugs. But today it is relevant to talk about the other aspect of this demography, and which is the demographic shift we are seeing. And this shift is not just an Indian phenomenon, but a global reality. And a fast shift which is happening towards aging population. I mean, we are shifting towards aging population. The people are becoming seniors in a big way. So as per the 2011 census of India, only 8.6% of the Indian population are above 60 years, which is numbering around 103 million elderly persons. So I said only just because what is anticipated or expected and what are the projections are really different. So and this 8.6% is what we are talking about. We got in 2011 census. So 10 years have already passed. So if this is the time for new census to come in 2021, so certainly there are going to be a lot of increase in senior citizens. Though the average age we say that it is 29. And according to the UN Population Fund report, what it says is that by 2030, which is only just 9 years hence, 12% of India's population will be the age of 60. And this is expected to increase to 19.4% by 2050. So when we say 19.4%, that is around close to 20%. So we can imagine what population we are talking about. It is the population of this country, India, and which already has 1.3 billion right now, so and 130 crores, and we are expecting that it is going to grow to somewhere close to 250 crores by 2050 if things move the same way. So this projection of 19.4% is right now being calculated as 30 crores in 2050. So just imagine the number of senior citizens we are going to have in this country. So that is going to be a huge demographic shift. Another interesting fact which has come out is that there are going to be more women than men in the senior citizen group. So I don't know, it's a good sign or a bad sign, and nothing to debate on. It's certainly it's good that the longevity has increased. I mean, right now the life expectancy in India has been said that it has become 72 years. So that is good. But with the sustained periods of growth, particularly in the health sector, the population is becoming more healthier and live longer. So when I say about more healthier, in literal sense, it is because that we have better medical facilities to address the health issues now. So this would result in increase in percentage of population above 80 years of age in a big way. It is also expected, as per this report, that around 6 lakh people over the age of 100 are going to be there in India. And India is going to have the highest number of sanitarians by 2050. So you can just understand what is going to be the demography of this country. The proportion of the people aged 75 and above is expected to increase by 340% between 2011 and 2050. So the growth of people living beyond 75 is going to increase 340%. So that is the LASI report which says. So that is why it is important to talk about the stats if you want to understand the issues that the senior citizens are going to have, or if you want to look into the preparedness that we are going to have. So as per the UN population prospect, the global life expectancy at birth for males and females has reached to 68.5 in 2015 for males, from 45.5% in 1950. So just imagine, from 45.5% to 68.5% in 2015. And for females, from 48.5% in 1950 to 73.3% in 2015. So life expectancy has increased, almost has doubled now. So and as I told you already that in India it has been already declared that it is 72 years now. So what is required now? Let me just peep into some of the issues faced by the aging population. Though we can celebrate the increase in life expectancy, people are going to live longer, We are celebrating the increase in medical facilities in this country and a better support system than that we had, say, 100 years back. But when it is coupled with the nuclearization of families, that is the social dynamics which has happened now. The dependency on others for their day-to-day maintenance has increased a lot. And it is the toughest challenge which is going to be posed on the lives of the elderly people. Seeing that elderly women population is going to be more than that of elderly men, the problem gets exacerbated because of the higher economic dependency. Another important aspect is that 70% of the elderly live in rural areas. And with the migration of the younger population for economic reasons from the rural areas, and comparatively the poor quality of medical services which is available in rural areas, it will throw more challenges to people, especially for those about 80 years of age. So it has been found that major problem that seniors face is mental health issues. And the main reason for early start of mental health issues amongst the senior citizens is more related to their loneliness, isolation, and forced solitude. So with nuclear families becoming order of the day, if they do not engage in active, productive, dignified life, the problems is bound to settle. So are we prepared to address these issues? Or are we preparing ourselves for such future? How focused are we on the living arrangements of the senior citizens? Living arrangements is the term which determines the social support system that one is having, which reflects in overall life satisfaction and quality of life. So I'm just hoping, and I'm sure that through this webinar, there will be a discussion in detail on all these issues. And after this webinar, we'll be able to create a roadmap. So thank you so much for having me here. And thank you for this wonderful participation we had yesterday, and hoping that it's going to be same even today. Thank you.
Yeah, sure. Thank you. We are this exercise with young students and youth, but also a lot of senior citizen groups and NGOs which are running old age homes, or those who want to get into elderly care, because this kind of amalgamation of experts and government people and students is quite a challenging task, but because of your support and encouragement, we have been able to do that. And I also want to share with the participants and also fellow panelists that the institute that Dr. Mishra is heading, National Institute of Social Defense, has been in the forefront of various awareness generation, information dissemination programs. And Anugrah has been partnering with them for last about 15 years or so. And the variety of programs that we do in capacity building, training on geriatric care, awareness building runs into thousands of beneficiaries so far in our last decade that we have covered. So thank you very much for your very exhaustive remarks. And now I have great pleasure in inviting Dr. Das. He's been a professor of marketing and founder dean of IIM Lucknow. With BTech and MTech both from IIT Delhi. He has doctorate from University of Toronto, and he has, to his credit, many national and international publications. He has worked with several prestigious international bodies like World Bank, ITRC, GTZ, etc. He's been on the panel of various committees and ministries of Government of India, and he has, in academics, he has been associated with teaching at IIM Ahmedabad and many other campuses of IIM, and even Austria. So, sir, I request you now as a director of Ford School of Management to please give your special address. Is Dr. Das logged in? Yeah, he's there. Yeah.
Please unmute.
Okay.
Thank you,
Thank
sir.
you, Dr. Abha Chaudhary, for a wonderful opportunity to me. And I'm personally very obliged for this interaction that I'm having here this morning. It's always a pleasure to interact in a program like this, where we are talking of one of the important aspects of society, which is the senior citizens. And we have worked with Anugrah for a few years now, and we have had very enriching experience working with them. This particular seminar on the day 2, which is being focused on senior citizens and inclusive societies and themed on issues and challenges. And I'm very happy that Dr. Mishra very succinctly pointed out the major issues that these senior citizens face, which is essentially loneliness, solitude, and forced isolation. You see that happening in your homes also. You have aging parents at home, and because of many social activities that one is engaged in, the boy and the bahu, or the daughter and the son-in-law, they will go away and attend to various activities, parties, shoppings, and everything. And by and large, the parents stay home. If they're both parents, then it's still manageable for them to continue to interact with each other. But if there is a single parent, senior citizen, only mother or only a father, then they stay back home alone. And this does create a problem. And over a period of time, the interaction between the single parent and the next generation, the son or the daughter, starts diminishing. The bright side of this is that these parents, senior citizens, once they have a grandchildren, then there is a revival of growing up. They fall back on the affection and love of the grandparents, and then they become engaged. In a rural setting, because of the community living, the senior citizens or people who are aged and they are in good health, they never would feel lonely or having a solitude life because of the community living. But with the change in the society, work practices, and the way we live our life, in the rural areas also, the kids go away to cities to work. So the parents are staying back, and then the loneliness is catching up, and there is a major issue. Now, because of the loneliness and because of the psychological distress that they may get into, it may lead to some kind of a ailment. And then the age factor comes in, and then you have a problem on hand. So as a nation, we need to be sensitive and aware of these issues, which was very nicely brought out very clearly by Dr. Mishra. So as citizens of the country and younger population, we need to be aware. And I myself, above 60 years of age. So you're stepping into that space, and you need to plan accordingly. In academics, the retirement age is 65. So there are a lot of people in the 60 plus age group still working. And the problem comes in once you retire, you have the problem comes. So one must figure out as to how to keep oneself engaged. This is marginally easier for people who are in academics and these kinds of profession. They can create their own space to keep themselves engaged, but that may not be true for almost 90% of the senior citizen population. So we continue to have issues at that level. At Ford School, we have been very sensitive to these matters. We organize these senior citizen activities. We sensitize our students into the elder care aspects and interaction with them. So we do that. Only last year we couldn't do it because of the COVID. We hope to do that once the COVID issue settles down. So this is a very important aspect to sensitize the young population in their 20s about the senior citizens and the issue. Get the feeling of satisfaction that you have been with them for some time. And in line with this, we are also planning to start a elder care and paramedics institute at our new campus, proposed new campus at Manesar. So of course, we'll take help from various departments of ministry, and of course, the Anugrah would be helpful to us in terms of framing certain methods that we would like to do. This is on the serious part of the senior citizen and the aspect, which there are a lot of experts who will be sharing their views. But I am able to recollect one interview of Dr. Deepak Chopra in the US, a very well-known MBBS doctor. And he also does a lot of health improvement aspects, which is not exactly yoga, but he goes into some of those aspects. And according to him, he says that the biological life of humans is 40 years. And he says, since we are intelligent, so we know how to put things together for our betterment. And he says that the bioforms are some of the bioforms of a kind which never age. And he gives examples of some biological entities which never age. So he says that with the genetic engineering in our control, maybe times are not far where we may have humans where the aging has been completely controlled and we may easily live up to 1,000 years and things like that. But on a more practical note, he says actually the way we are designed genetically, our life is supposed to be of 140 years. If it is so, then at the age of 70, you are in the prime of your age and health. So therefore, you should have a mindset like that and live life like that. And it gives you a lot of internal energy to continue your daily chores of life and spend a healthy day every day. Because a lot of problems comes in because people start thinking that I'm old, I'm incapacitated. So psychologically they feel debilitated and therefore these issues start cropping up. So Dr. Deepak Chopra says that look, at the age of 70, you're at the prime of age. So don't think that you're retired or you're retiring. You have a lot more to do now and start your day with much more vigor, but then you must have a target in your mind to achieve. And he goes on giving details on how one can actually live a life very healthy at that age. And then I recollect a story I saw on Discovery Channel a couple of years back, wherein they were describing that in California, they have a senior citizen township where they have, 60% of the population of the township is of healthcare workers and 40% are the senior citizens who live there. And healthcare worker would include some of the shopping malls which are there, where they are classified as healthcare because they are not a regular shopping mall. Because the customers are all, 80 plus kind of age group. So they need to be sensitive as to how to look after the customers who are walking into their store. And then there are health services. So in this Discovery Channel story on the TV, which I saw, it starts with a person who is shaving, and this anchor is talking to him behind the camera, and he says, like, Jim, like, are you getting ready to go somewhere? And he says, well, I'm shaving. I have a date tonight. I am going on a date in the US. And then the story builds up like that. And then this guy comes out all dressed up nicely. He puts the perfume on his face and everything, like a typical 20-year-old guy would be grooming himself. And then drives his car, goes to a restaurant, and he says, like Rosalind will be joining me for the dinner tonight. And he goes there, he buys a flower on the way, and there he sees a elderly woman standing around, and then they introduce each other, and then she says, well, I'm so and so, that they meet up each other. And then she says that you're late. So he says, yeah, I got late because of this guy with the camera is kind of accosted me, started talking to me. And they have dinner. And then they come back and they go to their homes. So the anchor is trying to project that look at this age, and this guy Jim is 84 years of age. So he says at the age of 84, he's looking forward to a nice evening of going out for a date, and he has a dinner over there. And the entire township is organized in that particular way. And he says that this is how they want to live. It's like I don't want to be dependent on. And they have within the township community centers where they can go and play. Now, as long as you're healthy, you can do this. If you're not healthy, then you have issues. So that's the only aspect that one may need to be sensitive about, that healthcare becomes important, make them agile and active to lead a more comfortable life. And once they are not well, then the appropriate healthcare services should be available. So we need to be sensitive to the elder care aspects, and we have organizations like Anugrah taking initiatives in this direction and sensitizing people and the government and institutions like us to do various activities to ensure that the elders are not ignored and they are looked after well by the society. And I'm sure the deliberations that we'll be having now, there'll be much more insight and wisdom coming in as time passes. Thank you very much.
Thank you, sir. It was you did cover a lot of aspects, and I think the emphasis that two major points I think you raised were A, it is absolutely very important for people to remain active, healthy, and productive as long as they can. And self-love and self-care is equally important. I think in India we give a lot of emphasis to families, especially women, elderly women. They spend their entire lives in taking care of us, their children, then their grandchildren, then household chores and stuff. But you know, their own health and what kind of diet they are having, what kind of schedule they should have, all that is relegated to the background. So I think that is A, your self-care and self-love is also equally important if you want to remain healthy, active till later years of your life. And secondly is the responsibility of youth. Whenever I have come to your institute, sir, and given lectures on intergenerational bonding, students have raised very, very pertinent questions. I think we cannot presume always and in every situation that youth is irresponsible or they don't want to be with elderly or they don't want to care for elderly. It's just that right time of right kind of tips, right kind of sensitization, because you know they are being either raised in very nuclear families, their grandparents are living away, so you know that kind of a bonding needs to be strengthened or reignited, and they are very much willing. They are your students have participated in our major walkathon in so many events, and the kind of learnings that they have gone back with, and even we have learned a lot while interacting with them. And sir, I think you forgot to mention about your very popular initiative of Ford School of Management. I think maybe I missed hearing about it, was Abhivadan, in which you bring senior citizens from old age homes and you give them a wonderful treatment. There is cultural program, there is lunch. I think Professor Shalini will be later in her vote of thanks perhaps dwelling more on that. And it is we maybe once COVID pandemic is over, we would hope that we do a bigger program along with ministry and other your institute and other interested bodies. So thank you so much, sir. And we move on to hearing from the inaugural address from Dr. Moole. I have the privilege and I would say, I mean, I know I met sir last year in one of the core group meetings on vulnerable senior citizens in National Human Rights Commission. It was a brief interaction. And this year in January, again, there was a core group meeting. So I happened to meet sir and interact again. And apart from the formal introduction that I'm going to read out for benefit of all the participants, what really completely impressed me was his very, very humble, very, very a lot of humility in his behavior, though he's such a senior government person with so much of accolades, awards, books, publications. I mean, a person of multifaceted personality. And I mean, it was the concern for senior citizens and especially the marginalized indigent group was very touching and inspiring. So we welcome you on behalf of NISD, Anugrah, and Ford School of Management. Our partners are also United Nations Information Center. So on behalf of all our partners, we warmly welcome you. And please allow me to read out your brief introduction. Dr. Moole has served as a diplomat in Indian Foreign Service, and he's a renowned author, motivator, and former secretary to Government of India. He's a celebrated author and a columnist, and since 1983 batch of Indian Foreign Service, he has served in various capacities, including Consul General and High Commissioner of India in various countries. He has written over 15 books. I have yet to see some of them. So next time when I come, I'll take some copies. I think most of them are in so many languages. I mean, Urdu, Kannada, Hindi, Marathi, of course, your very, very popular book, Mati Pankhani Akash, which was written and has received immense popularity, and it has been prescribed in the curriculum in the Maharashtra University also. And you have spearheaded several socio-cultural, economic, educational projects, including Balodayan, and a documentary titled Gypsy, highlighting the life and work of your good self, has been produced. This film has received a special jury award, and you have a book on Dr. Moole has also been published called The Passport Man of India. So, and Dr. D.I. Patil, University of Mumbai, has honored with Doctor of Literature for exemplary contribution to society. So, sir, welcome to this panel, and we are eagerly looking forward to hear your address. Thank you. Sir, please unmute yourself. Sir, please unmute yourself.
Okay. Is
Yeah.
it okay now?
Yes, sir.
All right. Thank you, Abha, for those wonderful words. Pleasing in the morning. This otherwise fairly depressing season that we have seen passing us by, but hopefully we are entering into spring, and that should perhaps take us to the joyous coming ahead. So let me congratulate you. What a delight it is to see that Anugraha, along with Ministry of Social Justice and Empowerment, Government of India, is organizing this 3-day national seminar series on dimensions of social and with SDGs. And also as a part of that, today we have this theme of senior citizens and inclusive societies, issues, challenges, and way ahead with partnerships, SDGs 16 and 17. So to begin with, let me say that it's a very laudatory effort in the SDGs pertaining to senior citizens, and also bringing people like me from the human rights angle, because I personally feel that human rights cannot be separated from issues being faced by senior citizens or any other what we call weaker or less privileged segments of our societies. So to begin also, I would like to thank all uh, the participants, the panelists, including two extraordinary speakers I heard just now, Dr. Virendra Sharma and Dr. Jitendra Das. It's very heartening to see that people are coming and joining these kind of discussions from very different backgrounds and bringing in different elements for the discussion. Now, it is a fact that by and large, so far, we have been generally, voicing our joy that that India is a young society, which is true, of course. One of the largest young population in the world, and yet in net numbers, India might be having one of the largest population of the senior citizens, and that is why I think it's a high time that we pay more attention to the issues concerning the senior citizens. Frankly, all of us one day hopefully will become senior citizens. People like me have already become senior citizens. So problems are all around us. I can say that unfortunately this morning I got a news that one of my very senior ambassadors passed away in circumstances perhaps in which he committed suicide. It's yet to be established. But I wonder what makes a person like him, who is otherwise well established, lives in a reasonably well-off community and society in New Delhi, not far away from the center of Delhi, who has done and accomplished a lot in his life. What would be the reasons for such a person to end his life? So I feel that could be a number of reasons. There could be maybe he's not able to interact socially because of the age. He's not keeping himself as active as he was in the past. He might be having issues which are related to psychology. Old age. We do have issues of attention, not receiving enough attention. other issues that maybe arise out of health and social interaction, career, or you have all the perhaps capacities, but there is no job. You want to still work even at 80. So I do feel that high time for us to recognize that this is a problem that is, we have to face squarely and try and see how best we can ease, how best we can comfort our senior citizens. Now, in the NHRC itself, we did start a working group, but unfortunately, still it is tagged along with the people with disabilities. I feel, and I have put up a proposal here that it should be a separate working group, because the problems being faced by persons with disabilities and senior citizens, some of them might overlap, but they are not exactly the same, and there has this distinction has to be made out very clearly, and those issues being faced by them have to be addressed also very differently. So hopefully we will have soon an announcement to that effect, and I'm personally looking forward to that. Giving another example, and I think Dr. Jitendra Das made a very pertinent point regarding senior citizens facing different problems in different communities. My mother, stays in my village. She is 92 years old. She lives in the community, and she is otherwise no major medical or health issue right now. My brother and Bhabiji are taking care of her, and the whole day someone or other is around her. That doesn't mean that she has no issues. She has to take regular medication for blood pressure perhaps, and other things. But what I see is the problems being faced by a similar person in, say, Delhi or any metropolitan city, and in a rural setting are very, very different. She has no, I would say, no psychological issues. She has no major physical issues, and she is gracefully, I would say, getting older and older. And I hope she, lives a very long life. But what I see is when I go there, there are not too many complaints. We hug each other, we, kind of express affection for each other, and she's upset always that I'm away from her. But other than that, she is living a fairly healthy society, and the ecosystem is healthier. My village doctor kind of can either meet her almost every day, or he can be consulted on phone or cell phone today. Today we also got a news about COVID-19 and the vaccination for the old age people. And I was very delighted to hear that now they would be, from the 1st of March, the government would be undertaking the task of vaccination for the senior citizens. Now, COVID has been a challenge. It has, attracted, or we have seized of the matter in NHRC. We have consulted all our experts, created an advisory, given it to Government of India and to the state governments, and we expect that these are, and action is taken on them by the government. Now, I personally know a number of occasions, and we do receive complaints about old age abuse of old people, senior citizens, particularly during COVID times. They have suffered a lot, and they continue to suffer. Particularly those segments which are not covered by any medical or health insurance. Those segments, that really belong to, what should I say, less privileged sections of our society. And also those who might be otherwise well off, but have nobody to relate to, nobody to talk to, nobody to live with, nobody to converse with. For example, the maids have gone away. Children are staying either in different cities or different countries. Their agony, they cannot even express. And we, as rightly said by Abha, that we need an emergency response team for such people who cannot access any help anywhere. And of course, there are issues of various kinds which have been identified nicely by a note sent to me by by Abha. For example, the specific risks during the COVID-19, and the situation pertaining to elderly, the impact on health. The impact on health, it could be tremendous, and impact on mental health too would be tremendous. And it will certainly negatively affect. No one knows right now what are the long-term effects of COVID, and whether it is on heart, whether it is on kidneys, whether it is on the overall immune system in the long term, even when you have recovered. I know a couple of people who passed away, including some of my friends, some of my relatives who have been victim of the COVID-19. And for example, in one case, I recollect that one hospital refused the admission. Second hospital said, wait, we will take 3 hours, and the patient died. I knew the person very closely. So these are the things that have, all of us have heard these kind of stories, and I think the documentation of these as case studies is very, very minimal. I haven't seen too much attention or focus given to this issue. Of course, we have economic conditions, which is a major issue now, as said by Dr. Jitendra Das. If we have the real natural possibility of living for 140 years, then I don't know to what extent there is a premium right now on youth. There's a premium right now on looking charming. There's a premium now on looking, what should I say, fashionable. There's a premium on being dynamic and being looking fresh and vigorous all the time, energetic. And obviously, senior citizens are unlikely to have the kind of display of vigor that you see in youth. And therefore, there is going to be, and there is already, I would say, a kind of a subtle discrimination against the aged people. Now, if the same person who is capable is unlikely to be employed as compared to a younger person, and therefore, I personally feel, just as we have these interesting job sites, which recruit younger people, why don't we have a job portal for people who have experience like senior citizens, and how we can use their capabilities? That will to large extent keep them busy, that will earn some extra money, which will help them to live comfortably. And economically well off, your social status automatically goes up. And this is a truth of bitter truth of our life, that economic well-being is always considered important marking of social status. Social isolation and old age homes and their roles is an important aspect. Again, old age homes is a reality, and I know Anugrah is doing some outstanding work, in particular in the daycare segment. Daycares are required. I am trying to currently work in establishing at least 2 to 3 such daycare homes in Maharashtra, which is my home state, with the help of expertise that we have in Anugraha, and personally Dr. Abha, because this is something I believe is provided for. There are funds both by center and the state, but there is a complete kind of a neglect, or I would say lack of prioritization on the part of administration. Let us really try and figure out how best we can have. At least recently, I think it was only Abha who told me that there is not a single old age home or old care center in entire J&K. So I don't know how it has happened, whether it has happened out of social neglect, whether it has happened because of the political situation. but it's very unfortunate. It can't be said that J&K doesn't have old age population, and therefore they don't require old age homes. It is likely that the family, what should I say, situation there, family system there is much more stronger perhaps. One is not, I'm not really an expert on that, but we need to have old age homes, care centers everywhere. And if one has to draw one lesson out of this pandemic, which has aggravated the issues pertaining to old age people, is that they need more focus of the society. They need more attention from the society. They need more care from the society. And in the end, they need a more humane uh, environment and ecosystem in our society. So with these words, I would like to thank Abha that, and I assure her and everyone here that NHRC as an institution and myself as a member as well as an individual would like to commit myself fully to the cause of senior citizens, and whatever assistance is required in this regard, I will be and we will be prepared to offer you readily and with wholeheartedly. Thank you so much, Abha, once again for inviting
Thank you.
me. I declare the today's session or conference open. Thank you so much. Once again, namaskar.
Namaskar, sir. Namaskar. Thank you so much, sir. Very, very enlightening, very comprehensive. Two things I would like to flag here, sir. The core committee of NHRC that you are heading is definitely revitalized and rejuvenated after you have joined in. And that was very much required. Two things, sir, that I think this committee should focus on is the condition of rural elderly, and secondly, women. These two are still areas which are not very much in focus, though we have revised, the ministry has revised a plan now, which is called National Action Plan for Senior Citizens. And some very expert groups also have been constituted of late, and a lot of changes in the care of senior citizens area are coming, which I think Dr. Mishra might like to comment and brief you on that. There are working groups, there are many other things, which have recently been initiated by our learned secretary, Mr. R. Subramaniam, and Dr. Mishra is heading all those panels, and National Institute of Social Defense is going to be the key coordinating body. So we are receiving a lot of support, but at the same time, I would also like to mention here that Anugrah is working very closely with judiciary and various local groups in Jammu Kashmir, sir. So on pilot basis, we have started in Leh Ladakh, Jammu, and Srinagar, but there is a lot of demand. Even today in this webinar, several people from Jammu Kashmir have joined in because there is a lot of demand from there. So hopefully we can expand our efforts with your blessings and help and support from Ministry of Social Justice and Empowerment. So Dr. Mishra, would you like to say a few words on the National Action Plan or the new groups that have come in, because that is very crucial for NHRC and other panelists to know?
Yeah, sure. Thank you, sir, for a wonderful address. And you have raised very pertinent points here. And so did Professor from IIM, Dr. Jiten Das. So already a national action plan has been put into effect. And besides that, what has recently happened is the ministry has constituted 7 empowered expert committees. So, and the best heads in the country have been put in groups of 3 or 4, and different issues they are going to handle. They are going to provide their inputs based on their own experience, the expertise that they have. And the idea is that it should not be more the policies be decided at the national level. It should not be decided at the national level just by the government, but in fact, it should come from the people who are working in the field. So already the meetings have started, and we expect that in April, so whatever they recommend, it would be converted into schemes and then implemented. So I think very aggressively the Ministry of Social Justice is working on these areas. And besides that, sir, already, we are coming up with a national helpline, which is called Elder Line, and hopefully it's going to start in couple of months. And the best part is 35 states and UTs have come on board. So already most of the agencies have been identified in almost all states. So except for West Bengal, all the states and UTs have come on board. So that is another big leap which has been taken in the senior citizen area. So I think a lot many things are happening in this field. So hopefully in coming months, we will see, sir, we'll be able to expand our outreach. And besides that, engage with the stakeholders who can give us meaningful inputs and who can contribute. Thank you.
Thank you, Dr. Mishra. Dr. Mule, there is a question from one of the students, and I think I would request you to please handle this. You would definitely, coming from a rural area, I'm sure you will definitely be able to give a good insight. So one of the students is asking, with a lot of youth willing to migrate towards metro cities and their parents, grandparents still in suburban areas or rural areas, how can we cater to such a situation?
Pardon, can you repeat the question?
Yes, sir. Yes, sir. Rishabh, a student, he's asking, with a lot of youth willing to migrate towards metro cities and their parents and grandparents still in suburban or rural areas, how can we cater to such a situation?
Well, I think unfortunately, we got a strange model of economic development. The model that actually separates the families, the model that uproots people, the model that apes the Western concept of development and material growth. And until and unless we change that model completely, I won't say upside down, but a fair amount of a change, if I may use the word transformation, we are likely to face this kind of situation on a continuous basis, continuous manner. We have to focus on creating jobs that are, I would say, rural, semi-rural areas, small towns, which are complementary to agriculture. I come from a farmer's family, and I can understand the agony of a child who has to leave his village. And I have not come out of that agony even at this, stage where I'm, already senior citizen. So that being the case, it's self-employment, complementary, jobs and entrepreneur enterprises to the agriculture and rural setting based on the resources. So to some extent, modifying Gandhiji's model of, development, we need to have a district development plans of a different kind that take into consideration the resources available, the agricultural products, the natural elements like availability of water, rains in that area, humidity or aridity, taking into consideration how do we use those resources so that they can be plowed back there and the surplus is sent outside to neighboring areas. I personally I don't see much of a reason in developing an extremely complex international economic order when we have very simple solutions at hand which can solve our issues and make it less complicated and easier for every citizen. Now, I'm sorry, Rishabh, don't have a straightforward answer, but we can work together on it. I'm ready to join you, to see from whichever area you have come, we can try and do something there to at least retain a few more people, because there is this allurement of cities, false, attraction of Bollywood images and the celebrity and icon culture that we have developed. But that's an entirely different topic. To retain your roots, you need to really go back. I have started something called giving back, the forum, where I'm encouraging people in urban areas to go back to their villages, towns, communities, original communities, and do something more, than currently they are doing. So maybe this is the long no solution. To see how we can, like in my village, 2,500 people have left village and come to the cities. They are all earning very well, but most of them are neglecting the village as well as their parents that have been left behind. And I'm trying to see how best they can be brought together. A kind of a network is created, and the older population in the village is looked after. This is just one example.
Thank you, sir.
I will add here, Dr.
Yeah,
Abha,
yeah.
would like to add, sir, and for sir's knowledge as well, sir. When we are talking about these empowered expert committees, few of the committees are, hopefully are going to address this problem, or at least will try to work on this problem. One is like, a sort of employment exchange is being created where already the persons who have skills, who have been doing good, so they get a job because, as we said, that the biggest problem is loneliness. So, they have to be constructively engaged. So for that, whatever skills they have, if it can be used constructively, that is one thing which should be done. So this sort of employment exchange is being created. Second is SHGs are being formed at the, at district level and rural level also, so that they can come together and start working. And for the malnourished persons, Poshan Abhiyan program is also being planned in the rural settings, in the rural as well as urban areas, semi-urban areas. And besides that, the skill development and skill enhancement programs is also in annual, so that what they have, they can further increase there and get engaged. So these are few more things which are being done, and certainly the rural elderlies will be benefited by that. Thank you.
As a closing comment, for particular this discussion, sir, and also responding to Rishabh's question, sir, I also feel that active engagement of Gram Panchayat level, sensitizing them and having small localized daycare centers, what we used to have earlier in our in earlier times, something called chopals in every village. So maybe more empowered chopals at the localized village level are the answer, where the community, the peer community, the elderly themselves have to come together, form a group and look after themselves, because youth will migrate. All said and done. So that's what I feel, more empowered and involved Gram Panchayats and local groups. So,
first year it is planned that 10,000 Gram Panchayat or municipalities would be engaged in forming those as self-help groups. So that is the target set.
Very nice. Thank you, Dr. Mishra. Thank you, Dr. Moole. We are actually running little behind the session, so I'll request Dr. Shalini to offer vote of thanks. And Dr. Shalini, I just wanted to ask, since the second panel is about to begin in another, we have time.
We have time. It will start
at
12:10. We have
12:10. So okay, fine. I was panicking because I didn't see the time. Okay, fine. So yeah, please go ahead with your vote of thanks. Thank you.
Thank you, Dr. Abha. It is actually my privilege to propose the vote of thanks for the 3 days national webinar series on dimensions of social defense, and especially its linkages with the sustainable development goals, and focus on Agenda 2030, and we are focusing upon 16 and 17. So this is day 2. Yesterday we had very enriching sessions across 4 different thematic areas, and today we are focusing upon the senior citizen, and tomorrow we'll be focusing upon entirely on transgender issues. And at the outset, I would like to express my profound gratitude to Dr. Virendra Mishra, Director NIST, who has always supported us, Center for Sustainable Development, Anugrah. Even when I remember when we went there to meet him, he has given a lot of inputs, how we can enrich, how can we make this webinar more successful. And I'm also very, very thankful to Moole sir, who is a member of National Human Rights Commission. Sir, your presence here is really, really appreciable and very, very acknowledged. From Center for Sustainable Development at Ford School of Management, we are very happy to have you here. And I assure you, from my center, we will look forward for more collaborative programs with the National Human Rights Commission. We have young population here. We are training the students, and I'm also very happy to share here that Ford School of Management is the first academic institute in whole India who actually started the CSR and sustainability, a core course in 2014, because we had this CSR legislation, that is Section 139, Schedule 7 of Companies Act 2013, when it became applicable from 1st April. I remember Das sir is also here. I remember under his leadership, we actually made that happen at Ford School, because it is very important to sensitize your student on various social issues also, along with the CSR and other sustainable development agendas. What we talk about 17 sustainable development agenda which UN is focusing upon. So thank you so much, sir. I'm also very thankful to my director, Dr. Jitendra Das. He has took out time because he is having a lot of meetings lined up for today. I know, sir, thank you so much to be here. It is really, really always a pleasure and always a blessing, because I can't express, because the way he has guided CSD, the way he has actually guided the various clubs where we have here. That's why Dr. Abha mentioned about Abhivadan. This is one of our flagship event here, which we do for senior citizen every year, where we invite the senior citizen from various senior citizen old age home. And believe me, it is all managed by our students. We just guide them. And it's just a beautiful event. All our students keep on waiting every year that when we are going to organize. So in whole day event, they organize a lot of activities for the senior citizen. I still remember, sir, you were the witness. I'm talking to Dr. Das. The student literally cried when they were welcoming all those senior citizens, because, sir, students who stays in the hostel, they are away from their parents. They are away from their grandparents also. So I think it was just an emotional connect which we all felt looking at our students who welcome them, who actually make them busy and spend time and do a lot of activities from their heart for all the senior citizens. So this is also one of the flagship event. We'll look forward maybe this year, if the things goes well, then we'll have Dr. Abha's Anugrah and also various ministries who are present here, the representative from them, to have this program at a very, very larger scale. And I'm also thankful to all our partners, even our sponsoring Ministry of Social Justice and Empowerment, Subramaniam sir, thank you so much, who is not here, but a sincere gratitude from Center for Sustainable Development, Ford School of Management, Anugrah, the NSD, and also United Nations for Center for India and Bhutan. I'm sure that the various sessions which are being lined up for today and for tomorrow will try to have a lot of deliberations, and all the participants which are here with us today morning from various rehabilitation centers, from various senior citizen centers, and especially the people from Jammu and Kashmir. We are very happy to have you here. All the students who are present, a great gratitude and thank you to all of you. Stay safe, stay healthy. Thank you very much, Dr. Abha. Over to you.
This muting and muting takes a while. So, okay. So now we are closing the inaugural session, and we should move to panel 1 now, Dr. Shalini. Yes?
Yes, please. Yes, please.
Okay. So thank you all, Dr. Das, Dr. Mishra, and now we have our panelists already lined up. Thank you, Dr. Gauri Sen Gupta. We are really delighted to have you here. You can hear me? Okay. You have to unmute yourself, ma'am. And we have Dr. Yeah, okay, good, we can hear you. So in this panel, which the title is Impact of COVID-19 Pandemic on Health of Senior Citizens, challenges and interventions is a very, very crucial panel. And I would like to share that we have three eminent different perspectives. From international agency, WHO has come. From the Government of India, Ministry of Health and Family Welfare, Dr. Gauri Sen Gupta, she's a focal point on NPHCE, which is the National Program on Healthcare of Elderly and Public Health. She's from Directorate General of Health Services. Very, very warm welcome to you, ma'am. You have been spearheading the campaign for healthy aging, and I've been personally working with you. And then we have Dr. Ravi Dikshit. He is the Joint Director, Kevaladham, Mumbai. He'll be speaking on the alternative systems of medicine, yoga, meditation, naturopathy, and things like that, which keep elderly healthy and active. And as the last speaker of this panel, we have Miss Atrey Ganguly. Very, very warm welcome. We just connected last evening, and she is the focal point on Decade of Healthy Aging. So warm welcome to you, Atrey. So all the panelists are here, and our first panelist is Dr. Gauri Sen Gupta, ma'am. So please do go ahead, ma'am. Welcome.
Okay, thank you so much, Abhaji, for a wonderful introduction. I have one issue that I cannot have a share content screen button, which is
Okay,
showing.
okay. I'll request the IT team. Anuj,
Yeah.
can you? Yeah.
Yeah.
Okay.
Kamalji, please give ma'am the sharing rights.
Yeah.
So that ma'am can share her screen.
Yeah.
Please wait for a minute. Yes.
Ma'am, done.
Over to you, ma'am. Yes. We can see your screen now, ma'am. Over to you.
Yes, I'm this thing. Okay. Fine. Kind of thankful. At the outset, I'd like to really congratulate Professor Shalini as well as Abha. She's been an old friend and we've worked professionally as well as personally. But I must congratulate Professor Shalini. We meet for the first time for taking this initiative through a business school. Although we do have the biggest push from our Honorable Prime Minister that there should be a very healthy interaction between the private sector and the government sector and all other sectors in everything that is possible, not just for monetary benefit. So it is a wonderful thing that we are getting into this. Dr. Virendra Mishra has already highlighted the various mechanisms that are already there. So, and also getting to know that Atrey is going to be speaking on the international perspective of Decade of Healthy Aging. I have kind of taken out 5 slides from my presentation because then it'll be an overlap with Atrey. So my concept is, or my talk is going to be basically for the elder care with a focus on the health systems response, specifically in times of COVID. So without fail, I'll be starting my session. Please feel free to question or put your questions in the chat box. I think we'll be able to take it at the end of it. There is a lot which needs to be said, but I've tried to restrict myself to just about 20 slides to give you a brief overview of the whole situation of elderly in the country in the last 1 year, and also how the National Program for Healthcare of Elderly has been kind of trying to garner support from various systems, not just from the health sector. So this to be at the point of even kind of repeating myself, census, Dr. Virendra Mishra already told you, we are at 10.4 crores elderly with approximately 75% of them reporting at least one or the other chronic illness. So elderly people, as far as the definition in India goes, are those people who are above 60 years of age. They as it is, have a lot of issues of being susceptible to a dual burden of disease, that is your communicable diseases as well as non-communicable diseases, better known as hypertension, diabetes, stroke, and all the other issues that plague all the people after about 40-45 years of age due to unhealthy habits and due to not having proper care-seeking behavior and identifying and taking care of it. So these people are already at a kind of a double whammy because of the COVID infection, because they already have decreased immunity due to their aging processes. The body reserves are depleting day by day, whether it is muscle wasting, whether it is nutritional requirements, and also they have multiple associated comorbidities, like India being considered as the diabetes capital of the world, and diabetes along with hypertension leading to multifactorial problems and multiple systems getting affected, with kidneys kind of shutting down. Then you have stroke occurring because of some or the other clot getting stuck at some of the arteries. You have COPD, that is chronic obstructive pulmonary disease, most commonly asthma and all, which is compounded by the pollution that is being faced by all the people, specifically the elderly. So this is like a triple whammy that the elderly people face, and compounding it was the risk of COVID infection. Second important thing which you have to understand is that although COVID was not a very serious illness to be considered for a general person, say less than 45 or 60 years of age, for elderly, there was a higher risk of COVID progressing to a severe illness. So maybe if anybody less than 60 years developed COVID-19 infection, maybe it would take about a couple of days, say maybe 3 to 10 days to recover. Whereas for an elderly, it was going to be compounded and more level of complications would occur for the elderly. So these two things were very, very important for identifying how to tackle elderly with COVID infection. Third important thing was that COVID-19 in elderly would not be according to the classical symptoms that were seen in the other people. Maybe it is the children's age group or the adolescent or the adult age group. They could be absolutely asymptomatic and they could be COVID positive, and suddenly one fine day, you have some kind of a complication and mortality occurs. Or they could also present as an exacerbation of pre-existing symptoms or disease. So maybe if I have multifunction, if I have diabetes and hypertension, I could present with a myocardial infarction, or I could have a simple stroke. But the only thing is that the COVID-19 infection has kind of speeded up the original disease which was there inside me. And third, which was reported by a lot of geriatric clinics, was unusual presentations, like the person would be absolutely okay, and then suddenly there would be confusion, like suddenly somebody would come and say ki kuch bhi bol rahe hain, and there would be what we call as acute delirium or acute dementia kind of a state. So these were like unusual presentations which kind of compounded the diagnosis and kind of even delayed the treatment seeking. Physical distancing and challenges in accessing healthcare. This was another thing which led to complications for elderly, because when COVID started and there was a lot of physical distancing that was required, access to healthcare, all the hospitals, the dispensaries, the clinics, they were kind of shut out. And because elderly were more susceptible, they were to be isolated. inside the house or wherever they are, whether they are in a old age home or whether they are living with their own family. So this distancing and isolation led to multiple issues with them. Even if they were not COVID-19, keeping supposedly healthy elderly cooped up inside the house led for all sorts of other issues, particularly social isolation and loneliness. Although family members were there, but still somebody would be going out to get daily provisions. Plus, elderly have this routine that they like to follow on a daily basis. Their morning walks are sacred to them. That 1 hour of social interaction that they have in the parks, or maybe going to get milk, or maybe going to drop the grandchild off to the bus stop. These are not just chores for them. These are more of social outings for them. Even going to the dispensary or the hospital to get their medication also involves interaction on a personal level. So when all this was stopped, this led to a lot of loneliness in them. And for those who were like single elderly, like Dr. Mole was saying, and even one of the students had pointed out, that there are a lot of elderly couples or even what we call a single elderly, just one spouse. The other spouse has died or not available with them. So a single elderly living alone, their access to daily food and medications at this time was seriously curtailed. Most of the community-based organizations who were like offering some kind of assistance, maybe in the form of giving access to pensions, providing food, providing medications, providing all sorts of activities. These organizations or even the NGOs had closed physical operations. And everywhere, either it was only meal delivery services or it was available, any interaction was available through online only, which is not accessible to a lot of elderly. So hence, elderly with chronic conditions needed a lot of support through pandemic. But another factor which was also important was that attention also needed to be given to caregivers of all elderly, specifically those elderly who are immobile and at home. So whether it is a family member who is a caregiver or whether it is a professional caregiver or what we call as a formal caregiver. So in COVID-19 situation, we had a triple whammy of the elderly suffering in case not from physical ailments, but from psychosocial ailments of isolation and loneliness. Secondly, in case they had physical ailments, that itself was compounded because of the COVID-19. And thirdly, caregivers were also cooped up with no assistance from any other place. So considering all this, if I may say so, the Ministry of Health and Family Welfare, the biggest, our first approach towards addressing COVID-19 in elderly was developing access to proper information. So a lot of stuff was created within, I would say, March, April, May, June, those kinds of things. Like you had a lot of awareness materials, including audio visuals, which was for yoga, meditation, social stigma, because there was also an access, there was also a condition in which elderly were ostracized within the family and within the community also, considering that they may be the source of infection for the family or the community. So this was, it was really difficult to address all this. So hence, a lot of awareness materials were made. They were involved in preparation of reusable face masks and face shields. Guidelines for medicine use for COVID as well as for non-COVID patients were made. hospitals and laboratories for COVID testing. Elderly were specifically slotted into the vulnerable population after a lot of effort. Helplines were created. I'm sure most of you are aware, but this is just to give you a brief overview of what all was put into force immediately after the lockdown was declared. There were email IDs where technical queries could be done. I'm sorry, the psychosocial helpline by NIMHANS is not there. NIMHANS started an exclusive psychosocial helpline in which you could dial in and you had counselors giving you all sorts of information. Under the National Program for Healthcare of Elderly, a specific health advisory for elderly people was shared amongst all the states and all the districts, and at the national level, at the Ministry of Health and Family Welfare website, the National Program for Healthcare of Elderly website, and all the states and UTs also were there. These were devised after a lot of thought process went to it. Then the Ministry of Health and Family Welfare then came up with this wonderful thing of developing face covers ourselves. So considering that biomedical waste management was becoming a lot of an issue because use and throw masks were kind of littering everywhere. So these were done. Now, one of the very good examples of this was the information that was given to me by a few states, that this face mask making at home had turned into the best example of intergenerational bonding, with 2 states reporting that elderly grandparents and children together were making face masks for the whole family, and they also went up and they gave it to the healthcare workers also. So that was one of the very good practices. Now, other than that, the NIMHANS also took out some specific psychosocial advisories for the elderly people. And Arogya Setu was launched, which could be downloaded and found out. The COVID India Seva Twitter handle was absolutely active. Then, along with Ministry of Social Justice and Empowerment, the General Advisory, which was for senior citizens' homes and other people, was also generated. NGOs and everybody came up. What was more important was the focus that was there for elderly. That is, you have to stay at home, stay connected. You may be at home, but even if you are alone, you need to be staying connected and have support. Then personal hygiene was stressed upon. Daily medications were provided and they were to be taken. Ensuring nutritious diet with fresh home-cooked hot meals and hydrating frequently, because when elderly tend to not go out for any activity, they tend to not hydrate themselves frequently. So that was there. And more important was that a lot of immunity boosters were suddenly cropping up, and elderly were kind of counseled that in case you've been taking something continuously, it's okay, but suddenly out of the blue, removing your own medication and just going for immunity boosters is not going to be helping you. Exercise was stressed on, at least 30 to 45 minutes per day, including sunlight exposure to improve the lung power, and focusing on resistance and balance exercises with household items. I remember because of lack of time, I didn't put photographs out here. One of our state program officers had sent me a wonderful video of an elderly couple in which they had 2 water bottles in their hand and they were trying to do those balance exercises at home, walking on one straight line. So physical distancing from anyone who is ill, wearing a reusable mask if possible. And most important thing was infodemic awareness, what we call as the information epidemic, which was rampant and is still rampant through social media, but not much lesser than what it was at least 8 months back. So what was stated to them was hearsay and see only positive news, and that too only from reliable sources, specifically like ministries or specifically from proper websites, and not just through those forwarded messages of WhatsApp. sharing their fears and illness symptoms, even if they are very unusual or abnormal, with any of the family members, healthcare workers, especially if they had fever, cough, or breathing difficulty. And this time was also used in a very nice manner by a lot of urban elderly to skill themselves on the various apps that are available on the mobile. Now, for caregivers, what was addressed that first address your basic needs, develop a system for addressing yourself, your personal hygiene, your medications, your own health, and a system of proper nutritious meals, and then take care of the elderly. So in case the caregiver does not take care of himself or herself, it is not possible to take care of the elderly. And more important, that if the caregiver falls ill, then he or she is more susceptible to give illness to the elderly. Not ignoring any unusual or abnormal symptoms, I'm very happy to state that through the helplines and through our Ashas and Anganwadi workers, we got to know of so many elderly who had developed just plain confusion states. And suddenly somebody would report that ye 3-4 din se khana hi nahi kha rahe hain, or he or she is just staring into space. And that was just because of, considering that why am I suffering from COVID-19 when maybe my friend or my next door neighbor who is also 70 plus or 80 plus is not suffering. Maine koi paap to nahi kiye. They keep on doing introspection all the time. So these kinds of unusual and abnormal symptoms were also to be identified, and we were happy to have identified it. And identifying ways to stay in touch with people even when self-isolating. I think that was one of the best examples. The speed with which even the semi-urban and the kind of suburban elderly, even rural elderly, learned the art of doing video conferencing was amazing. So all was not bad in COVID. Taking care of your own health and hygiene, and even if there is an immobile or a bedridden elderly, caregivers were kind of advised to take regular breaks, listen to some music, or do something which kind of gives you mental peace. So considering the health system's response, I always say this, that COVID is a blessing in disguise for elderly, because for the last 5-7 years that I have been running this national program for healthcare of elderly, it has been an uphill task for us to sensitize all the state governments, to sensitize various stakeholders that, elderly issues are not just the end of life issues. It's not that an elderly person is just waiting to die. They have a lot to achieve, and the time period that is there that they have to survive should be as productive as possible to them and to their family and society. So I would say that COVID-19 has been the positive side effect, or the adverse effect of COVID-19 has been the focus that we have had on elderly since day one. The health system's response has been found that only a single-pronged approach will not help. So that needs to be multi-pronged, and we have initiated multi-pronged approaches, and fortunately it is continuing. Short-term quarantine is essential to address the pandemic, but isolationism leads to collapse, and this has been evidenced throughout all the states and through all institutions, not only the family, but even through old age homes and assisted living centers also. So the real antidote to addressing any epidemic, not only the COVID-19 pandemic, is cooperation. Cooperation between the various sectors, the various service providers and others. Best defense that humans have against any pathogen is not just isolation, it is information. And to defeat COVID in elderly, mutual trust and cooperation, that is healthcare system with the patients, with the family members, with the community, etc., is the only way that we can defeat any kind of an epidemic, even after COVID-19. And this was also the best time to promote intergenerational bonding. Now, the strategies of the health system response were 5-pronged. The first and the most important strategy, which we had initiated way back in March 2020, and we are still continuing it with it, is that to counter an infodemic, you need factually correct scientific information